Dr. Varga, what's your role in this? Could you just explain?
I'm the Chief Clinical Officer for Texas Health Resources. This is a worker who works at Presbyterian who was involved in the care of the second visit.
Second visit?
Yes.
Was it someone who was considered a part of that high-risk pool?
No.
Was it in the lower risk pool?
Yes. So all of our workers are following CDC recommended precautions.
Can you say if this person was wearing protective gear?
Pardon me?
Can you say if this person was wearing protective gear when they came into contact?
They were.
They were wearing
They were.
protective gear?
Going further on Manny's question on protective gear, are we gloves, mask? What other protective gear was this person wearing?
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
How disturbing it is that even after those precautions, this person is still contracted the disease.
We're very concerned. But we're confident that the precautions we have in place right now are protecting our healthcare workers. All of these steps are being taken so the public and our own employees can have complete confidence in the safety and integrity of our facilities and the care we provide.
But if ye will not hearken unto me, and will not do all these commandments, and if ye shall despise my statutes, or if your soul abhor my judgments, so that ye will not do all my commandments, but that ye break my covenant, I also will do this unto you. I will even appoint over you terror, consumption, and the burning ague that shall consume the eyes and cause sorrow of heart, and ye shall sow your seed in vain, for your enemies shall eat it. And I will set my face against you, and ye shall be slain before your enemies. They that hate you shall reign over you, and ye shall flee when none pursueth you. And if ye will not yet for all this hearken unto me, then I will punish you 7 times more for your sins. And I will break the pride of your power. And I will make your heaven as iron, and your earth as brass. Your strength shall be spent in vain, for your land shall not yield her increase, neither shall the trees of the land yield their fruits. And if ye walk contrary unto me, and will not hearken unto me, I will bring 7 times more plagues upon you, according to your sins. I will also send wild beasts among you, which shall rob you of your children, and destroy your cattle, and make you few in number. Your highways shall be desolate. And if ye will not be reformed by me by these things, but will walk contrary unto me, then will I also walk contrary unto you, and will punish you yet 7 times for your sins. And I will bring a sword upon you that shall avenge the quarrel of my covenant. And when ye are gathered together within your cities, I will send a pestilence among you, and ye shall be delivered into the hand of the enemy.
We know that 48 people who may have come in contact with Eric Duncan, of course, the gentleman who passed away, the first Ebola case here in the United States, they're being monitored right now, and they're showing no symptoms. They're asymptomatic right now. They're being watched. But the second worker who came in contact with him on his second visit to the hospital was wearing full protective gear.
Gown, glove, mask, shield, following the CDC guidelines. And then you heard from that doctor there, they are very concerned when their doctors are following the guidelines and it still is a confirmed case. So we're crossing our fingers that this is the last one that we're going to see, but folks,
and Dr. Varga, the chief medical officer that we just saw of that hospital, indicated that this patient was part of a so-called low-risk pool, probably based upon the fact that the patient had been provided with full CDC-approved protective gear, including protective gear to protect the mouth from droplets from vomit or sputum or some other kind of bodily fluids. We've also heard that the apartment complex where this victim, the second victim of Ebola in Texas, has been cleaned by a hazmat team, and that in a 4-block radius of that neighborhood, there have been 911 calls and police officers that have gone out to speak to people in that particular neighborhood. I think we're seeing the impact of just one additional case in the state of Texas in terms of manpower, resources. And I think one of the things you were pointing out as we were watching this together, Clayton, is that we did not see a representative of the CDC here at this particular press conference.
Some of the optics struck me during watching the press conference when they mentioned the CDC isn't here and also the state isn't here. Wouldn't you want to see your governor during this time? Wouldn't you want to see the CDC? What could be a bigger story that they would have to deal with right now than a second confirmed case of Ebola and having the CDC out in front publicly talking about it? We saw the mayor of Dallas, Mike Rawlings, who's done a great job trying to calm fears there in that area. But it seemed like as those questions were being hurled at the doctor, we weren't getting answers. What sort of care is this worker getting right now? What sort of treatment?
Part of that, Peter, is because the victim and the victim's family have asked for privacy. We know that the healthcare worker is in stable condition, but we don't even know what type of job this healthcare worker had. The doctor said he couldn't reveal that because of privacy.
Under HIPAA privacy laws, the privacy of the patient is paramount, and the hospital is not allowed to reveal it. I think we'll see more revealed by the state and federal health authorities going forward today. Dr. Varga and others indicated that this particular patient was part of 18 employees at the hospital who were being monitored, some in a high-risk pool, some in a low-risk pool. We don't know specifically what the high-risk monitoring was and how many people are actually being quarantined or isolated as a result of exposure. But we do know that health employees at that hospital were exposed not once but twice. The first visit when they didn't pick up the 103-degree fever and the nausea and the African travel. And so obviously, and Dr. Siegel was talking about this earlier this morning, all health workers who are not aware of a victim's Ebola diagnosis are at risk. But this particular victim apparently, and they don't say whether it's a doctor, a nurse, an orderly, some other aide, was in full CDC regalia and still got the disease.
And labeled a low-risk individual. Labeled a low-risk individual when she was interacting with the patient when he came back for his second visit. They also said that a pet may have come in contact with it. They're monitoring the pet. The mayor of Dallas talking about that.
They have plans to go into the apartment later, the fire and rescue and hazmat team, to try to decontaminate the apartment. They've already done so for the parking lot surrounding that and going around. They're knocking on doors and handing out flyers literally for everyone in the neighborhood. There's a lot of questions this morning.
And some of the precautions that at least they're taking at the airports. We just got word that right at JFK and some of the larger airports, they're starting to do the temperature monitoring to monitor patients or folks as they're getting off those aircraft there. So we'll have much more on this latest development here as the second case of Ebola confirmed from a healthcare worker down there in Dallas. We'll bring much more to you this morning. Ebola spreading inside the United States. Brand new information at the top of the hour here. Keep it on Fox News Channel. Good Sunday morning, everyone. A Fox News alert now. Another case of Ebola inside the United States. Texas Health Services confirming this morning, just a few minutes ago, a Dallas healthcare worker has tested positive for the deadly virus. The worker came into contact with Thomas Eric Duncan. He's the first person to die from Ebola, you'll recall, inside the United States. Doctors saying the worker saw Duncan on his second visit to the hospital and at the time was deemed a low risk. The hospital, though, confirmed the worker followed all CDC procedures. A press conference at Texas Health Presbyterian Hospital wrapping up just a few minutes ago.
We're still confident that the precautions that we have in place will protect our healthcare workers. We don't have a full analysis of all of the care. We're going through that right now to try to understand specific elements of who came in contact with Mr. Duncan, around what circumstances, on what day, etc. But we're confident that the precautions we have in place right now are protecting our healthcare workers.
Is this person self-quarantined?
It's interesting. You think about the precautions that they put in place, right? The CDC guidelines for this worker. So they're confident that the precautions they've put in place will protect future workers. Well, let's remember that they were following CDC guidelines, so this worker was covered in full gear, full protective gear, including the face mask.
Gown, glove, mask, shield, everything, yet still contracted Ebola. This second confirmed case. We don't know a whole lot about this healthcare worker, even their exact job at the hospital there. The family and the victim have asked for privacy. We do know the patient is in stable condition and is in isolation.
And we understand that the patient was considered part of a low-risk pool, although one of 18 different Texas Presbyterian Hospital employees who were being monitored. Officials there say that the apartment where the patient was living has been treated, as well as the area. We also learned, it was very interesting, the emergency room at that hospital has now been closed. And they're indicating that emergency cases are being sent to other facilities. They didn't specify as to why that's going on at this point. We do know, look at the history in Africa with Americans that have returned here, do look at the case of the Spanish nurse, and now this employee at this Texas hospital, there's a high rate that we've seen of healthcare workers who have become infected by the Ebola virus. And we do know that according to the hospital here, that this employee was complying with all the CDC protocols, as we've talked about.
Yeah, we talked to Dr. Mark Siegel about it earlier on the show, and he mentioned that, these healthcare workers, they are the most exposed, of course, when dealing with these infectious diseases. Listen.
Healthcare workers, Clayton, are the ones that are most exposed. So I don't want people out there to think it's spreading wildly now. That's not it. It's that the healthcare workers are the ones who are most in contact with a patient's secretions.
And also some curious things from that press conference that just wrapped up a few minutes ago. We saw the mayor of Dallas coming out there, Mike Rollins, and he's gotten some praise for really, keeping a handle on this locally there. But it really is not just a local issue. When you have obviously what's unfolding right now at JFK Airport with the temperature monitoring this morning is now in effect. This is a national issue. So noticeably absent from that press conference was the CDC. Also larger state officials there. So it was just really being left to Dallas to handle it at the local level. Yeah,
and what's happening at the airports, we told you about this yesterday, that JFK is starting this thermal monitoring, checking the temperatures of passengers coming in from West Africa, and that protocol is going to be put into place on Thursday at 4 other airports as well. That takes in about 95% of passengers coming in from that part of the world.
And clearly information is key at this point. I think we'll be getting some more information as the hours go on and as the day goes on, but certainly confidence and calm is needed in that area, and of course across the country as we learn more as to what happened here. The other interesting point is that some officials at that press conference made it clear that they had almost anticipated not this particular case, but the fact that there might be other cases. And so the question becomes, what were the CDC protocols in terms of quarantine and isolating patients like this who turned out to, in fact, have the Ebola virus? We know that they deemed this particular patient to be low risk. What about the high-risk patients? What about the family and relatives of the late Mr. Duncan? What about the family and relatives and friends of now the second patient in Dallas? So I'm sure a lot of people in Dallas are saying this morning, who is that person? Yeah. Should I be concerned? So it is a matter of privacy, but it also becomes a matter of public health. And so should people have the opportunity to know whether they've been in contact? And I'm sure the CDC is working on that now. Well, there are also questions this morning as to what the government knows, the federal government knows about this virus. A lot of people on Twitter, a lot of viewers this morning watching this show and letting us know, saying we want the truth about what our government knows about this particular virus. And if you have a person, a worker, covered in full CDC guideline garb, contracting this virus, what else do we know? Are we trying to, tamp down fears about it? But we want the truth. And as Dr. Siegel has said several times on this air over the last couple of weeks, sometimes fear is the greatest virus. So information can quickly eradicate that.
Right, and what we know about the virus is that it's spread through bodily fluids from human to human contact, or through a medical device or something that's contaminated, like a needle. So, I mean, it makes you really scratch your head when you hear that doctor say that this particular healthcare worker was covered in the exact way that they were supposed to be according to CDC guidelines. What answers to questions do we have about Ebola, and do we even know what to be asking this morning?